station you can't live without. GLRADIO.
Get it locked in.
On GLRADIO with Dr. Stephen.
Wow, good afternoon to those here in the Asian belt, and good morning to those in Africa, in Ghana, in South Africa, wherever you're listening to us from, and I would say midnight or dawn to those in the Americas. My name is Dr. Stephen AKITI, and I'm your host for the GLRADIO show here, transmitting from Wenjo, and I'm back here this week to give you a time-fulfilling knowledge on health issues. So, tell a friend to just log in and let's discuss more about health.
Health Talk on GLRADIO with Dr. Stephen.
So today we'll be discussing about tapeworm. In the past weeks, we've been talking about worm infestation. And worm infestation is one of the major problems in human beings because it's a parasitic issue that we face all the time, since we eat from different sources and we also get our food from different sources. We get our meat from different sources, and we don't know how these meat or these food stuff are preserved. We also don't know how they actually clean before we eat. We as humans in this time and age, we find ourselves eating more outside our homes than actually eating our home meals because of our work schedule, because of our education, and also most often because of sometimes social events that we find ourselves at. We drink from different places. We drink from certain disposable cups that may not even be clean just because we think it's a disposable cup. We don't have a problem. We actually ingest things that may be risk factors for these worm infestations. In the past week, we've been talking about certain worm infestation. We've talked about whipworm. We've talked about certain roundworms, and all this has revealed to us that these worm infestations are parasitic infestations that we can do away with if we decide to go along with good personal hygiene too. All the preventive measures are put in place, and also we adhere to taking our anti-helminthes or our anti-worm drugs. Some people call it dewormers, at least once or twice every year for those who are not in endemic areas such as the US, the UK. If I talk about the US, I'm talking about Northern America, the UK, and also parts of Asia, places like Korea and Japan. But for the rest, we advise that you take the rest of the endemic areas. We advise you take your dewormers at least once every 3 months, or at least once every 6 months, which helps as a prophylactic measure in taking those worms out of your system. So today we're going to be talking about tapeworm infestation. Yes, we are talking about tapeworm.
Health Talk on GLRADIO with Dr. Stephen.
Mic check 1, 2, GLRADIO. Get it locked in.
So, tapeworm infestation. Let's look at what tapeworms are, and we look at how it affects us as human beings. And we check, we discuss how we can prevent these worms from infesting us. So someone asks, what are tapeworms? Does it mean that tapeworms are worms that are used for tapes, or is it that it's a worm that looks like a tape measure or or something? Because you'll be wondering why the name or what tape measure or what tapeworms are. Basically, tapeworms are just long and they are segmented worms, which comes from a big class called the Cystoda. So in science, we have classes, we have species and all that. So they are from the class of Cystoda. And this comprises about 1 to 3 classes of this parasitic worm. As you know, all these worms are more of parasites, because parasites, as we say, if you say someone is parasiting on you, that means it's taking something from you without giving you anything, isn't it? So these worms are parasitic worms, and they come from the class Cystoda. Yeah, so they actually these worms lack intestinal tracts. That means that they don't have any intestines. So what they do is that they just absorb nutrients through their integuments. So that means they absorb nutrients through their pores. Yes, they don't have any stomach, or they don't have any intestines for them to actually suck your blood or take something from you and then digest it. No, they absorb the freshly cooked nutrients that you have. They take it directly. This is how they work. And if you see a tapeworm, it consists of a head, and the head, in science terms, for the scientific people listening to us, is called a scolex. So this head, what does that is part of the adult worm. Then then it also has a part of the body. Okay, then we have the neck, you have the head, then we have the neck, then we have the body segment. And it will surprise you to know that just one adult tapeworm has the head, the neck, and it has both male and female gonads. That means, if I say both male and female gonads, that means it has both male and female reproductive system on the same worm. So this worm, it is already made. This one is already made. This one, you can't. It has both male and female reproductive organs. So what it does is that it's able to interfertilize itself. It doesn't need another male, or it doesn't need a female gonad to come and fertilize it. So this is how the tapeworm looks like. Now, the head of the tapeworm that is called a scolet is where the worm will normally attach itself to the human intestines or whatever animal it finds itself, to be able to take out those nutrients directly. So since it doesn't have an intestine, that's what I'm telling you, it will just take the nutrient that your body has worked out already. Wow, this worm is quite interesting. It doesn't like raw food. It doesn't like raw products. It likes the product that you've already worked out. So this is it. So you when you find this worm, this is how it looks like, and we normally advise that tapeworms, they are long. They are usually longer than the whipworms that we know them to be. Now, these tapeworms, the cystodes, they have types, but we have about nine of them. But today I'm going to be talking more about 2 of them. Probably I may add a 3rd one if we have time. So you have about 9 of them. You have the Tinea solium, which is normally found in pigs. We have the Tinea saginata, which is normally found in bulls or cattle. That means beef. We have the Diphyllobothrum. We have the Hymenoleuthis, which is normally found in fishes. We have the Spirometra. We have the Tinea morticista, and we have the Ankylocosis. And we have the canium. So we have the decanium. So there are about 9 of them. I don't bore you with the scientific names, but let's look at about 2 of them. But before we look at those 2, let's look at how this worm gets into our system and how it functions. Yes, so as you all know, the last time we talked about how all these worms, most of them have eggs, and the eggs will hatch into larvae, and the larvae will hatch, and the larvae will then change into the small worm, and the small worm will then do what? Change into an adult worm. Yes, it's the same, but this one is quite different because this one needs certain hosts to be able to grow. So what happens is that this one, it requires one or more hosts. So in this host, for us to understand, I'm going to elaborate on what we call the divisions of the host. So we have what we call the primary host, we have what we call the intermediate host. Okay. So the primary host just means that, the eggs that will be produced by this tapeworm. That means that the eggs that are produced by this tapeworm are released into the environment by the primary host. So if you remember last week, we talked about hookworm, and that one it just has one primary host, which is humans. So it's the humans that release these eggs from their feces into the environment. So a typical one is human. So that's primary host. Then we have what we call the intermittent host. So the intermediate host is that animal or that living thing that the eggs that have been ingested will hatch in. So if you inject or you eat something that has those eggs, the place that it will be hatched is what we call the intermediate host. And also and also it's the same place where the larvae will also enter your tissues. So for instance, if it gets hatched in, let's say, a dog, and then it gets hatched, it gets into a larva stage, and the larva keep moving from organ to organ, we can call that host as intermediate host. And the primary host also ingests the cysts in the flesh. Okay, so that some of them, as I was telling you about the Tinea solus and Tinea saginata, which are normally found in beef and pork. If let's say humans eat those flesh, what it does is that means you also tend to be a primary host, because even though you are bringing it out, you are also eating what is in that flesh. So that is it. So we have all this, but with time I'll be explaining more about this whole primary and intermediate host for you to understand properly. And now let's look at the two major tapeworms that we'll be talking about today. With time, we'll be discussing the rest, but unfortunately, we don't have that much time to discuss all the 9. But I'll be giving general information on the rest of them as time goes on. So don't go anywhere. Let's just be here.
I'll stop on GL Radio with Dr. Stephen.
So when it comes to these worms, let's talk about the 3 most common ones, which is the Tinea solum, the Tinea saginata, and we talk about the Diphyllobotrium species, which is found in fishes. So the solum is found in pigs, human, dog, cat, sheep, saginata in cattle, and the Diphyllobotrium is found in fishes. So, and with all these ones, their primary host is humans. That means it's humans. So their primary host is humans, because humans are those who bring out their eggs in terms of feces. And their intermediate host for Tinea solum, are pigs or dogs. So that means that let's look at Tinea solum. So when an infected soil passes on or gets into the arms of humans and humans eat them, what happens is that those eggs get into the human system. And when the egg gets into the human system, the eggs then get pushed, and now they turn into larvae, isn't it? So when they turn into larvae, they are then pushed, and the larva migrates to other parts of the system, other parts of the body, but they mostly will go and settle in the intestines. And in the intestines, when they become more of adult worm, what it does is that it's then sent out. So you push it out of your system. So push it out of the system, that means that the egg comes out as we see it in the soil. And if the pigs go eat part of that's infected soil, what happens is that the eggs will now be in their system, and the larva in that pig's system, what it does is that it goes into their flesh, eats into their flesh properly, and stays there. So if it's there, it will be there and to be growing as an intermediate host. So whilst there, if humans catch a fish or catch a cattle, or they are able to kill a pig, and these pigs or these fishes or whatever are all have all been infected, when you eat them, you also be infected with this tapeworm. So that's how come, if you remember, in the past they used to say that if you eat pork, you have a lot of worms in your belly, and your belly will become big, and it's pork. Even some people have superstition that when you take pork and you use lemon or lime juice on it, you find worms coming up. It's not entirely true. It's just trying to tell you that those superstitions were there so that people will cook their meat properly before they eat. But medically, there's nothing like that. It's just the same thing that they found, the Tinea solus, the Tinea saginata, and also the other one for the fish. So it works that way. Now let's look at something. Now let's look at how this thing works. So when the adult the adult worm that is found in the intestines, right? What does that? It will produce what we call embryonated eggs, and these ones come out as feces. Okay, when these come out as feces, what it does is that it will, and people eat it. When it gets into your stomach, it will penetrate into the intestinal wall. Then some of them will move into your liver. So, for instance, if it's a cattle or a swine or any of those animals that eat it, it will get into their intestines. Then it moves into their liver, their lungs, wherever. Especially, you find it more in their skeletal system. That means in their flesh. So it goes there and it finds itself there. So whilst there, it forms a cyst. So that cyst, what happens is that it will form a cyst, and then it will then attach to the flesh and be getting nutrients from the flesh of those animals. So when we eat them as human beings, we bring them back into our system. So now when they enter our system as human beings, this is what happens. It goes through our mouth. Now it comes into our stomach, but in our stomach it doesn't really stay long. It tries to get into the intestinal tract. Then in the intestinal tract, it's able to move to other places. But whilst it's in the intestine, what it does is that it tries to look for more of the celiac area, so that it can be able to absorb more produce of fresh, already made nutrients such as vitamin B12. So they start taking a lot of vitamin B12 from you. Then what happens is that they start forming cysts. So cyst is just a collection of a space with a lot of fluid. So they'll form a space there in your organ. So they'll normally move through to your liver, your lungs, your heart, your pancreas, your gallbladder, even your skeleton. And usually they may just choose one place to be. Normally in children, they find it very nice in the kids' lungs. So they get there and they form a cyst. So if I say a cyst, it's just like a visible pimple. But this around this pimple, this swelling doesn't have parts, but it has normal fluid in it. So it's in there, and they are also in there enjoying themselves. Now, this cyst can be there for long, and this cyst can not only be found in this place, but most of the time, and one of the most serious ones for this worm infestation is that this worm can go to any part of your organ. So it can enter your skeleton and form a cyst there. It's the most serious of them is when it enters your brain to form a cyst there. So when it enters your brain, it forms a cyst there. That means it causes a defect in your brain. Then it will start feeding on wherever it finds itself. So tapeworm is one of the most wicked and one of the most selfish parasites. It's not bringing anything to you, but it's coming to actually feed on the already made nutrients that you are making, even cause more damage to you, the host that is in. So this in a nutshell will actually give us a thorough view of how we expect our distance to look like, how you expect the signs and symptoms to look like. So if you look at this, the worm can get into any part of the body, any organ of the body. In children, it likes to be in the lungs. So it gets into the lungs, and when that cyst gets ruptured, you find out that this kid will start coughing, to start having chest pains, immediate chest pain. They may even start coughing out blood at very, very high speed. And with them also in the liver, you find out that people will have issues with liver problems because they start having jaundice. That's the yellow discoloration of their eyes, their palm, their skin, and some of them will even have start having difficulty in clotting their blood, and it goes on and on. And some will even have what we call ascites because they tend to be blockage of certain biological chemicals that are supposed to help in helping the body with equilibrium in fluid. And some people will find out that their feces may even become white because what happens is that it may even block the biliary tract and prevent your bowel from helping in other forms. So it's this worm, this tapeworm is very, very wicked. It can enter your pancreas and cause acute pancreatitis. It can also go into your skeleton and cause you to have what we call pathological fractures. It will feed on your skeleton bones, and your skeleton bone become as soft as a cotton, where you've not yet had any accidents, but you realize that your bones are having problems. Now, one of the most serious of them all is they going into your brain to settle there, to cause most often you find out that they may even have they'll form a cyst. We call it the embryonal cyst, okay, where it will be expanding and expanding and expanding. This cyst will expand. So when it gets into, especially when it's in the central nervous system, especially in the brain, it causes most people to have seizures. Yes, so seizures, people will start having seizures, and these seizures are part of afebrile seizures. So you will not. They are not warm to touch. They don't have fever. It's just that the cyst has become bigger, and this is we call it a cystic. We call it a cysticercosis. Okay, and it's a syndrome, so it has a lot of other symptoms. But for those that happen in the brain, we call it a neurocysticercosis. So this one. It will come. You find people with a lot of seizures. Some of them will be confused. Some of them will have neurological defects. Maybe if the cyst is at the bronchus area, that means that person won't be able to speak properly. If it's at the place that, especially if it's at the occipital area, then, or at the back of the head, then that person will have problems seeing, will have sight problem. Is at other parts that enables them to walk. Then you see that person will have problems with walking. And it is surprising that it's just a small worm compared to your big body that is causing all this problem. And these things are very serious. For those that are found in the fish, they mostly will be in your ileum and absorb your vitamin B12 and cause a lot of vitamin B12 deficiency. So you see, these things in itself it's a tragedy, and we mostly see this worm infestations in as I said, mostly in the South Americas. We see them in Southeastern Asia. We see them in Africa. Yes, but most of the time the incidents have started reducing because there is now more treated ways of feeding our stock, our livestock. So the pig, the fishes and all that are being treated, and they are treated with good feed for them to be able to feed and not have any infestation from this worm eggs. And also, there's no racial risk or protection. That means it's not predominant. It's not as if it's predominant in blacks than whites or whites. Everybody can be infected. There's nothing like a gender parity. But when it comes to age, it's normally found in children, because kids, as you know, will find themselves eating and playing on the floor, putting their hands in their mouth after playing in the sun. So as I've always said, that it's very necessary for us as parents to always do what? It's very necessary for us as parents to always check and make sure that these kids are washing their hands properly. For those who even have a game or a place where kids play with the sun at home, it's good to once in a while disinfect the sun. You can call those who are masters and that to help you do that. Now, let's look at how people present with. For instance, if you get infected with this disease, what are some of the signs and symptoms that you will come out with? Don't go anywhere. We are still here on GL Radio.
Health Talk on GL Radio with Dr. Stephen.
Listen to GL Radio on the Zeno app. Download the app now on Google Play Store.
GL Radio makes yes, I feel.
The radio station you can't live without. GL Radio. GL Radio. GL Radio.
This is the hottest radio station.
Mic check 1, 2, 1, 2. GL Radio. Get it locked in.
Welcome back. So let's continue with where we left off. We are now going to talk about some of the presentation or what signs and symptoms to see when people are infected with this tapeworm. Basically, tapeworm infestation will some of them, most of them, as I'll say, will not even come with issues that will even show that you have tapeworm. So in medicine, we may say they may be asymptomatic, and that means at the early stages you don't even see anything that shows that you have worm infestation, because it's just at the early stage. Yes, but with time, with these three, the most common signs and symptoms that you find will be, one, people will start complaining of epigastric pain. If I talk about epigastric pain, that means pain above your navel area, going just close to your chest area. So they may start finding pain then, because when this larva start migrating, it migrates through all those places, so you start having epigastric pain. Some of them too start having peri-umbilical discomfort. That means around your umbilicals there may be some discomfort there because it's moving. And also some will complain of nausea. That's the feeling to vomit. Some, because there is worm infestation, they are taking the raw food. That some of them will feel hungry all the time. They will always feel hunger. That's how come, back in the days in Africa, when they realize that you're always complaining of hunger, they tell you, hey, have you dewormed? Have you dewormed? There's that belief that if you are always hungry, you need to go get yourself dewormed. And science is proving that those superstitions were actually not just superstitions, but they are African way of noticing that it's time to deworm. Some patients will actually lose weight. There's weight loss. And some of them have what we call anorexia. That means they don't even feel like eating at all. While some are hungry all the time, some will not even want to eat. So the opposite is possible. So one will come, I don't feel like eating. The other one, the appetite is so high that he's always hungry. Then some of them, you find out that they'll have what we call the inflammatory response when the cyst I talked about gets ruptured. So when the cyst like that gets ruptured, what happens is that the body sees it as a foreign body, so it releases certain chemicals. These chemicals don't just come and look at them and say hi. These chemicals are chemicals that when they get there, they try to fight whatever is happening there. So they get there, they release more chemicals, and this response will actually manifest as something like fever, headaches, shivering, and the rest. So also in a long way, you may also find some of them, as I've already said, when they have the neurocystic sarcosis, they'll have a condition like they'll start manifesting as seizures, and some for those who may have this worm infestation, the cyst moving into their lungs, they may start coughing hard, they may cough out blood, chest pains, they start having body itches when this cyst gets ruptured. And mostly when they get ruptured around where the skin is not far away, you find out that you start having certain rashes, you start itching a lot. And some of them will start having allergic rashes that we the last time I explained to you, that's called urticaria. So you find all these things all happening. Some of them will also present as vomiting and diarrhea, especially the one found in fish, the diphyllobotrine. Yeah, that one found in fish. You find it in the most of the time, the Tinea saginata, which is the tapeworm infestation that has the beef or cattle as its intermediate host. What it does is that one thing it's usually known for is to cause obstruction of the appendix. So it will cause the obstruction of the appendix, the biliary duct, and the pancreatic duct. So what it does is that it will cause your appendix to get obstructed. So you start having symptoms of appendicitis, where you have abdominal pain. Normally the right iliac fossa, that means the right lower part of your abdomen will start paining you, but you start having migrating pain. It will start from the umbilical area, then move to that side. Then you start having pains, you start having vomit, fever, all that. And also, as I've talked about the biliary duct already, that some people will find their feces discolorated. Pancreatic duct is the same. So people who don't even have diabetes will start having signs and symptoms of diabetes, because the insulin may be obstructed from its effect. So just this worm alone is able to cause a lot of issues for us. And it will surprise you to know that this worm actually, because it can go to any part of the body or any organ in the body, it can manifest as anything. As I've told you, if it's in the lungs, you start coughing. If anywhere it is, you start having these issues. So we always advise that let's go for what is best for us, which is the prevention part of it, because it's very necessary. In a case of let's look at in a case of tinea solum that is found in pork, the one that a lot of people know. One of the major things that it does is that apart from it being in the brain and causing the neurocystocytosis and causing you to have seizures and those focal neurologic issues, there's a high possibility. Research has shown that it also causes what's called hydrocephalus. Hydrocephalus is when you see, those people or those children that you see with very huge heads but very small body, and their heads keep increasing. What happens is that this worm will going to cause an obstruction in the drainage ability of the cerebrospinal fluid. That is the fluid that is around the brain and the spinal cord. So it's going to prevent the one from the brain from coming down. So it will cause it to cause high tension, and the fluid will just be retained in the cranial cavity. So when it does that, it causes the cranium to expand, and that's what we call hydrocephalus. So just this alone, it can also go a long way to cause meningitis. Meningitis, as we know, is the inflammation and the infection of the meninges. That's the outer cover of what the brain and the spinal cord. So, and meningitis is one of the most serious cases that can cause death. So if you think worm infestation doesn't cause death directly, you can see now that it can cause other things to make you die. So let's take it serious. Let's see this as a serious case. And also worm infestation, when it gets into your brain, it can cause you to have dementia. I know some few days ago, 5 days ago was Valentine's Day, and Valentine's Day being there means that you people would have remembered that there is someone you love. But when you start having dementia from this worm infestation, Val's Day will come and you even forget that you have a girlfriend. Then you start having problems. You even forget what you did some few minutes ago. You tend to lose track of time, and this will not only be seen. And so if you have such case and they send you even to the neurologist or the psychologist thinking that they could help you, they'll not be able to help you, because the main cause of it is just worm infestation, which can be prevented and can be solved. So these things are quite serious. They are very, very serious, and I per se will advise that let's go to the path that is best, which is what we call the preventive one. So when we prevent all this, it will help us. And as I've said, that they usually suck the well made or already made nutrients like vitamin B12. So when you lack vitamin B12, it causes you to have symptoms and signs of what we call megaloblastic anemia. And this anemia can go a long way to actually affect us as people. But all this causes can be prevented, as I always say. Now, when you have all this, how can we be able to find out that when you have all these signs and symptoms, how will we be able to even find out that you have this worm infestation? Don't go anywhere. We'll be right back.
I'll stop on GLRADIO with Dr. Stephen.
Yeah, welcome back, and we we're talking about tapeworm. We'll be looking at how to see how to check and know that all the symptoms will cause us to have how to know that all the symptoms are caused by this worms. So let's look at how we can see that. Normally, when patients come to the hospital, apart from this signs and symptoms, we need to affirm that this patient has this worm infestation. So we because of how this whole thing goes about, we may take samples from different areas. So, for instance, we know that when the worm gets into our system, it moves and goes into our intestine. Then we bring it out through feces. So these feces, we collect feces, about 1 or 2 feces specimen. Then we do an analysis under the microscope to see if we find some worms or some larvae or some eggs in there. When we find that, then we know that, okay, then this is caused by so and so and so and so. So maybe it can be Tinea saginata or the others. It's very important for us to do this since it helps give us the picture of what we are dealing with. Then we can be able to solve it properly. So it's one of the best things for us. So apart from that, let's look at this carefully. So sometimes, especially the one found in cattle, Tinea saginata are eggs, and this eggs, it is surprising that the way they are, you sometimes find them around the perianal area. So if you talk about the perianal area, it means that areas around the anus. So your anus, the areas around your anus. So just that area, you can even find some of the worms there. So we can even do what we call the perianal swab. We take a swab of your anal area, and we also look through it under under the microscope. So it helps us a lot. So for instance, with that one like this, when we get it, then we know, oh, so you have such worm infestation. So even with those ones, when they find themselves around the perianal area, what it does is that you start having itchy inner area. So your inner area will become very itchy, very itchy. You have to be scratching that place once in a while. That's how you find people walking, they're always scratching their anus. We also do what we call the complete blood count, CBC, or in the English, in the British colonized countries, they will use full blood count. When we do that, we look out for what we call the eosinophil count, which shows that there's parasitic infection. So it also correlates with whatever we are finding for us to say that, okay, maybe there's normally when there's much, you find out that the eosinophil count will be very sporadic, and to correlate with whatever we are looking for. But in all this, I talk about some of the complications when we find them in certain parts of our body, and I said this tapeworm can go to any part of your body. Now, if it's in your liver, when we do a liver test, we'll find out that you are having some irregularities in your liver, but without any infections. But with the eosinophil count of the parasitic identification, we can actually say that means the larva has been to your liver before. But for us to be sure of all this, we may even do imaging. So we may do a CT scan or an MRI of your chest, of your liver, of your inner organs. And when we find them there, we start treatment. Now, the most serious one that I always talk about on this show happens to be the neurocystic psychosis. So the neurocystic psychosis is in your brain, right? So for us to be sure, when we start having cases of seizures and all that, we will do a CT scan of the brain or an MRI for us to check what is happening in your brain. When we do that imaging and we find out that there's a cyst there that has the level of any of these worms in there, especially the tinea solum that is found in pigs, then what we do is that we start treatment immediately. So we do all these things just to be able to make sure that we have a full idea of how the worm has affected your human state. So don't complain when you go to the hospital and the doctor tells you that, oh, you have worm infestation, and tells you to go do imaging, to go do an MRI, CT scan of your brain, and you be complaining that just worms. No, we need to find out what is happening to you, because the more or the larger the cyst, then the more the neurological defect or even the effect of that organ's physiology on your system. So look at all this. Apart from that, we nowadays we also do what we call the immunological testing. That's the ELISA testing. That's an image linked immunosorbent assay that we do. So we look at that. It's all part of it, and I believe that we will all get there. So it helps us to identify the particular immune lesson of this infection or this one. And tinea infection in itself is one of, as I've always said, it's one of the most dangerous things. And so apart from that, we may even do a PCR, what we now do for COVID. People now know PCR because of COVID. So what it does is that it will magnify whatever is in there for us to see if there's a small lava or whatever worm infestation that is happening in your system. So this will help us know that, oh, okay, then it is worm infestation. But now, after knowing this, how do we treat? How do we treat this? How do we treat this? Somebody will ask, how do we treat it? But thing is that not all the patients with worm infestation will walk to the hospital. Some of them may be having seizures when they come to the hospital. Some of them may collapse. So when you have all these things happening, then you know that the treatment for it is not just it's not just a one-way thing, It's not like the others that we just give dewormers and it works. So depending on the presentation, then we treat accordingly. So for instance, if the patient comes with an emergency presentation of seizures, of coughing, blood, then we treat the symptoms accordingly. Okay, so we may have to admit you at the emergency. We may have to give you some medication to actually prevent you from having seizures again. So we can give what we call the anticonvulsants, and we can also give, because as a result of the rupture of most of this that will cause inflammation, we give what we call corticosteroids that will help mild the inflammation. Then we may also give certain pain medication, especially if you find these things happening with people who come with pain. We may even give you antipyretics to reduce your temperature. But most often than not, one thing that we give you is the anti-helmintic agent, which helps in the killing and the taking away of these ones totally. So we have some of them. Example is the paracetamol, which is very much effective for the treatment of tinea solus and tinea saginata and the H. nana infection. And also because the one found in fish is a dye Diphylobacterium infection, it takes more of our victims away, so B12 away. So you have to give a vitamin B12 IV, like give it through the veins, so that this person may be able to recover from his vitamin B12 deficiency. And it goes on and on. Sometimes when it becomes so worse that there's nothing else we can do, we have to take you to theater and do what we call you have to open you up. As a neurosurgeon will have to take the worm out. So it helps us to help have all this, and it will cause you to actually understand that this worm can be able to cause a lot of pain, can be able to cause a lot of cases like this. Now, when this happens, even when we go into theater and we take the neurocystic courses from your brain, especially the one in the brain, you should know that if we don't go early and the mass becomes bigger, it may even cause permanent brain damage, and this will cause permanent focal deficiency, neurological deficiency. So you may have a neurological deficiency that will be permanent. That means that if, for instance, it was found at the place you speak, after the surgery, you may just be able to have blurred speech. If it's found out where you walk, that means you may just be able to have a akazic walk, and it's quite bad. So as I always say, let's always all the time do what? Follow the preventive mechanisms, and this is going to help us to be able to come up properly. You should know that it has about 95% rate of prognosis. That means immediately we give you the medications, it will resolve the problem. If you don't have the cyst in the brain that has become too big, but the others will resolve it easily for you. Now let's look at some of the things that will prevent us from getting this kind of infection. A very notable one, as we've been saying all this while, is make sure that we cook properly our beef, pork, and fish very well. We need to cook them properly so that it can be able to kill this larvae and this worm eggs in them. This in itself will be able to help us come out with something better, and even cook meat. So it's actually against law for us to use those who eat sushi a lot. Those fishes that they use for sushi have been tested. So they test them over and over again to make sure that there are no worms, there are no eggs in them. Maybe they find anything suspicious in those fishes, they throw them away. So if you observe, those fishes have a very short shelf life. Yes, it's very necessary for us to say this for you to know. And also in terms of preservation of fish, meat, and all those meats, you need to freeze them properly, because at a very high freezing point, those eggs also die. They can't survive it. It's very, 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 very important. Now, in terms of the fecal oral stuff, I'll say proper treatment of fecal matter is very necessary, and we should stop the indiscrimination, this defecation around, where you find even people with their dogs just on the streets, passing stool anywhere. And even with people who go for the stool from people's houses, they need to treat them. So you need to treat this latrine properly. So that's how come we have what we call the latrine treatment plant. So you treat them properly before you dispose them off. Most people dispose their latrine from the big tanks into the sea, but before you do that, you need to do what? You need to treat them. So you need to treat them properly. So you need to go through the latrine treatment plant. Otherwise, you find out that there will be a lot of this infestation in the fishes. Now, for the dogs who have or those, one of the things for you to know that these animals have this infection are, one, they may have fleas, a lot of fleas Dogs may have fleas around their ears, their bodies. Even cattle, you find them having fleas around them. They may start losing weight as a cattle. The pig, one way of knowing that it's possible that pig may have this worm is when the pig is on free range. It eats everything and nothing, is not caged. It's one of those community pigs. Those pigs, when you kill them, you need to make sure that you cook them properly and eat them in the right way. Now, worm infestation may be seen as something small, but as you've seen and you've heard today, you've realized that it's not just something that we can just brush under the carpet. It's something that we need to take seriously, and if we mean seriously, it's something that we need to take out as considerably important as we also take most of the cases that we see, even just as serious as COVID or any of the diseases. I strongly believe that whatever be the case, every disease is important for us to prevent, and one of the main ways of preventing these diseases is good sanitation. Good sanitation, good personal hygiene, which involves washing our hands, taking a bath, brushing our teeth. And most of the diseases that we find ourselves in Africa and Sub-Saharan Africa, Southeastern Asia, are just diseases of water and sanitation. So when we find this worked out for us, we won't have problems. So thank you so much for listening to me today. Before I go, just want to say a big thank you to all our fans out there, those who are always listening to GL Radio. We are quite happy to have you all the time listening to us. Before I go, I just want to remind you that in the coming months, which happen to be March, on the 6th of March is the independence of Ghana. And the Ghana community here in Wenjo is having a Ghana community 6th of March party going on. You can check that on our website, the Ghana Community Wenjo website. Just Google it, Ghana Community Wenjo. You see that we have events lined up. It's just a ticket of just 59.98 renminbi. It has been sponsored, so you just need to pay a little amount of 59.9 renminbi. For those who want to pay, just scan the QR code, register online for us to know that you are coming. Then you pay through the next step by paying to our one and only organizer, Yao, here in Wenjo. You are welcome to join us as we have this gala for ourselves. It's going to be fun that day. GL Radio will be representing them. We are going to have photo booths. So those who are in Wenjo and want to grace the occasion, please join us. There will be a lot of good food. There will be good music. We have the soul band there to give us some good live band music with their leader, Dr. Percy, who will be coming on around 3:30 to give us more insight of what is happening in China. Yes. So thank you all for listening to us today. And I would like to say that tomorrow is the birthday of our one only Vimbai and Taku here in Wenjo. We just want to say that God bless you. Happy birthday from we the Ghana community team, and from Yao himself. We want to say he loves you, and with the words I'm reading here, I can't read them out loud on my radio. I think he'll have to tell you himself. Happy birthday, Vimbai. Tomorrow is your birthday, and we want to start wishing you from today. Enjoy yourself, enjoy your night, enjoy your evening. Go get somebody to eat, and when I see you, I'll see you. Your gift will surely come. My name is Dr. Stephen AKITI, and I'm your host for the GL Radio show, Health Talk. And up next is Dreams and Destiny. Thank you so much for listening to us today. God bless you and have fun. Bye-bye. Keep safe out there because COVID is...
Hey y'all, you're listening to GL Radio. GL Radio. GL Radio. GL Radio.
You're locked into the number
Always
one
a better choice. Your songs on your radio. My one and only station. The best songs on the radio. This is my only favorite station.